Hello, my name is Mary Ellen Welling, and I'm the Director of Beaumont Health Sleep Evaluation Services. And today I'm going to talk about sleep health. Don't ignore a snore. It might be more than just a nuisance. Snoring, as researchers say, even without sleep apnea, causes thickening and abnormalities in our carotid arteries, and potentially this can be a precursor to atherosclerosis and other related cardiac diseases. So today I'm going to focus on what is sleep and why is it so important, and understand the different stages of sleep, understand some cardiac risk factors, and the dangers of sleep deprivation. What is good sleep hygiene? Did you ever feel well rested yesterday? There's a Washington, D.C. study over the course of a year and a half where they interviewed 20,000 Americans, adult Americans, and asked them, do you feel well rested yesterday? And the results of that study showed that 3 in 10 Americans did not feel rested. Sleep disorders, according to the National Institutes of Health, show that 50 to 70 million Americans are affected by chronic sleep disorders and intermittent sleep problems that can significantly diminish health, alertness, and your safety. Untreated sleep disorders have also been linked to hypertension, heart disease, stroke, obesity, depression, and diabetes, as well as some other chronic diseases. Sleep problems diminish health, alertness, and safety, as a lot of people are unaware. So what exactly happens when I sleep? Sleep's essentially essential to the working of every organ in our body. And in our brain, we have this command post called the hypothalamus. The hypothalamus activates and inhibits hormone production. The hormone production excretes and inhibits various hormones that initiate us to go to sleep and to wake up, like melatonin, adjusts body temperature, controls our blood pressure to the point that it can decrease our blood pressure 20 to 30%, controls our heart rate, which diminishes by 10 to 20% while we're sleeping. It activates digestive secretions and enhances our immune activity. It also inhibits pancreas from producing insulin, and it also can lower stress hormone, which is cortisol, and that's that hormone that energizes us. It also lowers growth hormone. Growth hormone diminishes over time, which accelerates and activates the aging process. Some examples of activation of melatonin production in helping us and assisting us to fall fast asleep. It also controls our body's proportions of fat and muscle, like lowering the hormone leptin, which signals us to be satisfied after we've sat down to a meal, or increases the hormone ghrelin, which would promote us to have a bigger appetite. So what is sleep? Sleep is divided into 2 basic types. There is the rapid eye movement sleep. There's the non-rapid eye movement sleep, which has 3 different stages that we call N. You have N1, N2, N3, where N1 is a transition from a wakefulness state of sleep, where our brain and our body start to relax. We start having like jerking and twitching, which is often common, and it lasts relatively a few minutes. The second stage, which is N2, is further relaxation. We're breathing and the heart rate's slow, and about 50% of our sleep time is spent in this stage. N3 is our deepest sleep, and it's difficult to awake us, and this is where brain waves start to move very slow. There's noticeable eye movement underneath our closed eyelids. There's slower breathing, slower heart rate. This is also called slow wave sleep, and this particular stage also decreases as we age. During rapid eye movement sleep, this is the 4th stage. That occurs roughly every 90 minutes with increased duration of time over the course of our night. So cycles It cycles oftentimes with N and N3, which is about 20 to 25% of our sleep. This is the stage where dreaming occurs, and the dreaming is vivid and memorable. Breathing's more regular, rapid shallow eye movement, and lack of skin reactivity, and exceedingly low muscle tone. I'll get into that a little bit more specific. So this is when you're awake. So this is what your clinicians are looking at. And ideally, the first two squiggly lines is our eyes. And in this particular example, the next two squiggly lines happen to be the chest movement and the abdominal movement. And then the next squiggly lines is how we measure snoring. And then we look at EKG. This is your heart rate at the bottom. Various electrodes are used throughout studies for us clinicians to be able to evaluate types of sleep disorders. So the EEG shows us brainwave activity, and the EKG shows us heart activity. We also measure oxygen. We look at your chest movement and leg movement and arm movement and abdominal movement, which will assess how much effort you are using to try to breathe during your sleep, and of course snoring. And this is just a snapshot. In stage 1, remember that's N1, the transitional sleep. It gets us from this wake period to sleep, and it lasts about 1 to 3 minutes. You can notice the top two lines with the eye movement, and the chest chest and the abdomen start to work a little more. And in this particular example, the bottom line you see is growing a little bit bigger because this particular example is someone snoring. You might feel yourself drifting off. There's the distractions around you start to become foggy and unclear. And if you nod off while you're driving or watching a movie or catch yourself bobbing your head or jerking, you may not be aware that it was sleep. It's very light sleep and you can easily be awake, but yes, it is still sleep. In stage 2, or the N2 stage, this is where sleep starts to get pretty serious. We spend a lot of time at night in this particular stage of sleep. The EEG, or the brainwave activity, starts to look a lot different and have certain characteristics that tell clinicians what stage you exactly are in at this point in time. Things like K complexes and sleep spindles are what we're looking at. But if you can look at the squiggly lines as compared to previously, you can see the heart rate's a little more regular, the breathing is a little more regular, the chest and the abdomen as well as eye movement is starting to occur. Stage 3, this is N3. This stage of sleep is thought to be physically restorative sleep. We secrete growth hormone in this stage. Young children will still experience more of this stage than older adults and adults. And this particular stage, as we grow older, starts to taper off because the older we get, the less time we're secreting that growth hormone. The most difficult stage of sleep for somebody to wake you. If you've ever had a small child fall asleep in a car or on a couch and you had to carry them back to bed, they're like wet noodles in your arms. Also, sleepwalking, sleep talking, and disorders such as that are during this stage are likely to occur. Children who experience night terrors or nightmares will often occur in this particular stage as well, and it can be identified by your clinician. The fourth stage, the last stage in this cycle, is REM sleep. This is your rapid eye movement, and it's often referred to as dream stage sleep. You can dream in any stage. However, in this particular stage of sleep, if you look at the top two lines, the eye movement is pretty consistent. It's going back and forth. The chest is musically moving as the eye movements are moving, as well as the abdomen to support respirations. However, your dreams are going to be more vivid and memorable. And dreams occur in REM, which is, again, your final stage. What's unique to this particular stage? It's called muscle atonia. This is where you have absolutely no muscle tone. You're basically completely paralyzed because it's restorative sleep. and you're trying to reserve energy so that you can restore and repair during this particular stage. You don't sweat in this stage of sleep. Systems basically are turned off to allow for renewing and restoring. And if someone acts out in their dreams, you might say they have REM behavior disorder. And since clearly there's no muscle atonia occurring because of the movement, they are lacking restorative sleep. And there's no rest that is occurring, no healing, and it impacts greatly on our immune system. There's also mental restorative restoration occurring during this form of sleep. And we convert short-term memory into long-term memory at this time, sort of like archiving what it is we have in our memory for later to recur to. Those who experience difficulty remembering may have the disruption or inadequate REM sleep. It's like an domino effect. You might have obstructive sleep apnea that constantly wakes you up and interrupts healthy sleep staging. And once we identify that and we correct that obstruction, you now have corrected the memory impairments. So what is sleep apnea? Sleep apnea is partial and or complete collapse of our upper airway in which a person completely stops breathing. And this can happen repeatedly during their sleep, sometimes hundreds of times during a 6 to 7 hour sleep period. And often it occurs and lasts for a minute or longer. 1 in 5 adults in the U.S. that will suffer from this sleep apnea. And most of these people with sleep apnea go undiagnosed. We see that all the time. If you look at the schematic, you can see in the first picture here where air should be going through the nose and or the mouth, and there's a nice clear pathway. But then when that person starts to snore, or maybe the soft palate up into the back of their throat, upper part of their throat, closes off, you can see where air is not passing through. It's an obstruction. There's 2 types of sleep apnea. There's the obstructive sleep apnea, or OSA, or there's central sleep apnea. The obstructive sleep apnea is a physical attribute that's occurring. With central sleep apnea, it's affecting the brain. And what happens is the brain fails to activate muscles to breathe, or it's the respiratory control center that happens to be shut off. And this impacts our central nervous system, and this is why it's called central sleep apnea. So here's an example, a snapshot, if you will, of a patient experiencing an obstructive sleep apnea. If you look at the top snore line on this schematic, you will see the long hashtags, our patient snoring, but you see with the straight lines here, that's where a patient stopped snoring and they stopped breathing, and that's called apnea. We can see with the snoring stopped, we can also see the chest and the abdomen stopped moving to assist with breathing. And at the same time, we're looking at oxygen values. Your oxygen numbers should be somewhere around anywhere from 92 to 100% all the time. And you could see right away where this person was having some difficulty, where they stopped breathing right here, immediately oxygenation slowed down and it diminished, close to the low 80s. What does a sleep physician do to assist you in screening if you have obstructive sleep apnea? We use a tool called the Stop Bang, and the acronym stands for Sleep Apnea Screening Tool for snore, tired, observed, pressure, BMI, age, neck circumference, and gender. And we go through these 8 questions, and we look at, do you snore loudly? Is that a yes or no? Do you often feel tired or fatigued or sleepy during the daytime? Yes or no? Has anyone ever observed you stop breathing during your sleep? Do you have or have you been treated for any kind of high blood pressure? And what is your BMI? If it's greater than 35. If you're over 50, if your neck circumference is 15 3/4 inches or greater, or are you a male gender? And if there's greater than 3 yeses, this places you at a very high risk associated with an obstructive sleep apnea diagnosis. So asking questions associated with each of these categories can help spot that at-risk patient who's not been assessed in a formal sleep study according to research. While you are sleeping, in the process of an event, like we saw with the example of the patient who was having an apnea event, in the very basic level of describing what is happening in our bodies when we have this event, airway gets obstructed, the heart rate fluctuates, oxygen levels start to drop rapidly, sleep gets disrupted, and that consistently repeats and repeats. And the cardiac consequences associated with that is cardiac stress on the heart, increased blood pressure that tries to compensate for that low oxygen, and a risk for developing cardiac arrhythmias such as atrial fib, tachycardias, and premature ventricular contractions. So here's an example, a little snapshot of an apnea that occurred, an incident, and it followed by a supraventricular tachycardia, a very dangerous type of heart rate, rapid heart rate. As you can see here, this particular patient's respirations are pretty rapid at around, the heart rate's around 43. Right about here, it starts to slow down. The patient's doing fine. And all of a sudden, they start to have this apneic event that triggers the heart to have these extra premature ventricular beats that go into this rapid supraventricular tachycardia, sometimes in rates as high as 150 to 180, when normal heart rate should be around 80 to 100 when you're awake, and somewhere where it's around 40 to 60 when you're asleep. At the same time, you can see that rapid drop in, again, the oxygenation. Cardiac risk with sleep apnea causes hypertension. It can cause myocardial infarction or heart attack, stroke, and congestive heart failure, just because of the stressors that we're putting on our heart every time that apneic event occurs. What could you do at home to assess yourself, to call concern, to maybe approach a medical professional to assess you further? We have this tool called an Epworth Sleepiness Scale, ESS, and by answering all these questions based on a 4-point scale of 0 to 3, you can evaluate whether or not you are at any kind of risk for a sleep type disorder. You would have to answer every single one of these questions and score yourself. And yes, it's very subjective, which is really good, but it's highly reliable, and it's a great tool to bring to your family practice physician or maybe your sleep physician. This 4-point scale provides a great estimate. So if you were to answer these questions like sitting and reading, how sleepy are you sitting and reading on average? How sleepy do you get just sitting and watching TV? Or sitting inactive in a public place, for example, like a theater, maybe you're at the cinema watching a movie, or at some meeting, or as a passenger in a car for about an hour drive. Lying down to rest in the afternoon, or sitting and talking to somebody. Sitting quietly after a lunch after your belly is full, or maybe after you've had, when you've had no alcohol. In a car while stopped in traffic. It's really important to answer all those questions, and it doesn't mean this is something that would happen all the time, but sometimes you think, yeah, I am sleepy. A range from 0 to 7 score would put you as an unlikely candidate to have a sleep disturbance or sleep disorder. 8 to 9 puts you at average daytime sleepiness. A score of 10 to 15 is kind of excessive, and it should cause be a sound for some concern for you to bring that to somebody's attention. But if you scored yourself at a 16 to 24 using the Epworth sleepiness scale, you really should consider a sleep evaluation. Sleep deprivation. We hear about it. We don't realize the impact that it does have on us, on our safety. You may have recalled a recent incident that was in the media regarding an actor, comedian, Tracy Morgan. Tracy Morgan was involved in a fatal car accident where a friend of his had died, and he had sustained and still deals with traumatic brain injury disorder due to a Walmart truck driver that happened to be awake over a 24-hour period and hadn't slept but 4 hours in the past 33 hours that led up to this accident. This person likely suffered from sleep deprivation due to lack of sleep, and not only lack of sleep, but unhealthy sleep. Sleep deprivation is an estimate occurrence in 20% of the adults, and it's a result of inefficient sleep. It's not healthy sleep. 38% of Americans reported 8 hours of sleep in 2008, and 28% of Americans reported getting 8 hours of sleep in 2009. And statistics show that we're getting less and less and less sleep. Sleep deprivation leads to psychomotor impairments, decreased productivity, performance issues, changes in our mood and behavior, and it does cause motor vehicle accidents. Driving while sleepy is exactly like driving being drunk. Motor vehicle accidents due to sleep deprivation have an estimated economic impact of $43 to $56 billion a year. And it's not just in auto, it's in health insurance for the injuries that it incurs. 16 hours of continued wakefulness in a 24-hour period is comparable to a blood alcohol content of 0.05%. 28 hours of continued wakefulness is comparable to a blood alcohol content of 0.1%. Let me put that into a little perspective. Legally drunk is 0.1%. That's 10%. That, if you took 0.05% blood alcohol content in a man who weighed about 140 pounds to 240 pounds, this individual's driving skills would significantly be impaired. Oops, previous. The effects of sleep deprivation not only affect our driving abilities and our safety, or even if you're in a work environment, if you're in a highly work environment where there could be safety issues at hand, it affects our health. It puts us at 100% risk for cancer. It puts us at very high risk for obesity, whereby they're 3 pounds a year over a course of 15 years is added onto us. It weakens our immune system when we have less sleep and puts us at 100% risk for that. And the risk for various heart disease is surmountable. It causes increased blood pressure, which puts us at a very high risk for stroke, and of course, ultimately risk for death. Is your smartphone ruining your sleep? Artificial light is one of those biggest causes of sleep deprivation in modern society today. And smartphone and tablets, the light, it really messes up with our sleep cycle. Essentially forces us to stay awake by convincing our bodies that it's actually morning. And how does it do that? Why, the blue light that comes from our smartphones and our tablets, our television, and our laptops is actually tricking our retina into sending a message to the command center of our brain, that hypothalamus, to stop secreting melatonin. The downfall of too much blue light. lowers melatonin levels significantly, which delays our sleep onset time. It lowers melatonin to the fact that it leads to cancer, because we need melatonin to support those immune properties in our body. It shortens our sleep, leading us to risks for diabetes and obesity, depression, cardiovascular problems. It even has been shown to cause cataracts and memory loss. The Harvard research showed that blue light can suppress melatonin for up to 2 hours. So think about it, if you're looking at your phone while you're trying to go to bed at night, or you're watching that television show before you shut your lights off and tuck yourself in, you are delaying your sleep by up to 3 hours, because it directly shifts our circadian rhythms, and it doesn't allow for all that 4 stages of sleep to start to occur. So how do we fix that? First of all, we need to know how much sleep it is that we do need. Infants and babies, they need about 14 to 17 hours of sleep. You know, they sleep all the time, and that's a healthy sleep. Toddlers, about 1 to 2, they require 11 to 13 hours of sleep. Preschool children, 3 to 5, also require up to 13 hours of sleep. And school age, 6 years old to 13, they require 10 to 11 hours of sleep. Teens, especially 14 to 17 years of age, they require 8 to 10 minimum hours of sleep. Young adults ranging from 18 to 25 up through and greater than 65 require 7 hours to 9 hours of sleep. This all has been supported and published by the National Heart and Lung, the American Academy of Sleep Medicine, the American Heart Association, and the National Sleep Foundation. In order to get good, healthy sleep, you need to have good sleep hygiene. And how do you do that? You start with maintaining a regular wake-sleep schedule, even on the weekends. How many times have you waited till Friday for the end of the work week so that you could just sleep in on Saturday or Sunday? That's really wreaking havoc with your circadian rhythms and not allowing you to maintain that sleep. Our bodies like habit. Avoid clock watching, because that stresses you out and that won't allow you to be able to have a relaxing routine prior to trying to fall asleep. We also want to try to avoid caffeine after the mid-afternoon, any stimulants whatsoever. And exercise, which is a stimulant, but not within 3 hours of sleep. So we want to exercise so that we can initiate all the hormones that we need to be activated within our system. But we don't want to do it just before bedtime. We want to establish that relaxing routine before bedtime, especially children, and use the bedroom for sleep activities and or sex. So try to keep those sleep stealers out of the bedroom, like avoiding the television or your computer or your tablet. Finish eating at least 2 to 3 hours before a regular bedtime. Remember, the digestive system starts to slow down and ultimately shut down while we're trying to sleep. Avoid caffeine and alcohol products, and don't smoke. And talk with your healthcare provider if you think you're at a risk. You want to try to create an environment that's conducive for sleep, like light and noise and temperature. And if you have to get up in the middle of the night to use the bathroom, it might be a good idea to install a red night light versus flipping on a bright light switch, because that bright light or blue light that hits our retina suddenly shuts down and inhibits the melatonin production, which will suddenly make us feel wide awake. So in this schematic, it's just a little rundown of how to sleep better and a reminder to us that we don't want to watch TV just before sleep. We don't want to eat heavy snacks or food a few hours before bedtime, and also limit our drinking of alcohol and eliminate alcohol a couple hours before we go to sleep. Use the smartphone wisely and the gaming with the television, and don't smoke. This is the end of my presentation, and thank you for your time, and good luck to you and healthy sleep.
Thank you.